As things look a little more like they used to this summer, schools and families are hoping, crossing their fingers, they're going back to school and it'll feel like back to normal. But the Delta variant could threaten that. Our Abby Larico spoke with two local experts about how we can keep kids safe.
COVID-19 vaccines offer significant protection against the Delta variant, the studies show, but that leaves those who can't get vaccinated yet more vulnerable to the strain.
We know that people have seen, just increase in number of cases in the young adult and children. They're in the unvaccinated population, at least those less than 12.
Throughout the pandemic, concern over serious complications centered around older adults. Dr. Jason Newland says he hopes that remains true.
So far, it doesn't appear children have more severe disease than the original COVID-19.
One of our indicators for how close to normal we are is kids in school.
I think it could have a significant impact on our schools, not whether or not they do open. We know we have ways of opening the schools. The big question is especially with our teenagers, the schools are talking about, do we decrease the social distancing? Do we make masking optional? And I think a lot of those conversations could be strongly influenced by what we see with the Delta variant around the St. Louis area over the next couple months.
Dr. Rachel Charney points to very rare instances of heart inflammation among teens getting vaccinated and to subsequent assurance from the American Academy of Pediatrics and the CDC that the shot is still a good choice.
The overwhelming benefit is still towards vaccinating our children and our young adults.
Data shows unvaccinated kids are safer if at least those around them get the shot.
And that is another reason to start vaccinating us, especially now as we've seen how safe the vaccines are.
The bottom line, our actions this summer might determine what this fall looks like. Abby Larico, 5 on your side.
We are still learning about the Delta variant symptoms, but it appears they're more subtle, like headache and runny nose. But if you're at all concerned you might be sick, even if you think it's something else, the doctors say it's a good idea to get a COVID-19 test.